Idaho Matters podcast is brought to you by St. Luke's On-Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on-demand care for common ailments such as a cough, sore throat, or a sinus issue. More information at stluke'sonline.org. Idaho Matters is taking a deep dive into the loss of farmland here in the Gem State. Are you a farmer? What challenges do you face as farmland shrinks in Idaho? We want to hear your story. Email us at idahomatters@boisestate.edu or leave us a voicemail using the Talk to Us feature in the Boise State Public Radio app. And then listen to our series on farming called Land and Legacy. Episodes available on Monday afternoons in the Idaho Matters podcast feed. More Idaho Matters now from the studios of Boise State Public Radio News. I'm Gemma Gaudette. How nurses are trained today looks very different from decades ago, from small hospital-based programs to cutting-edge simulation labs and advanced degrees. Nursing education has evolved dramatically to meet growing demand. And Boise State University, well, it has been at the forefront of that transformation, expanding opportunities, embracing innovation, and really helping to shape the next generation of nurses. And this year, Boise State School of Nursing is celebrating 70 years. So joining us to talk about the past, the present, and the future of this nursing program is the school's interim divisional dean, Kelly Connor. Kelly, welcome to the program.
Hi, thanks for having me.
So Kelly, I want to go all the way back to the very beginning, even before Boise State's nursing school. Take us back to 1902 and what happened that year in regards to nursing in Idaho.
Yeah, thank you. So in the early 1900s, that's when, Boise was starting to grow and there was a need for healthcare in the area. And so the Episcopal Bishop, Dr. Funston, from the Episcopal Cathedral, actually founded the St. Luke's Hospital back in 1902. And when they had that, they realized that they needed some nurses to help care for patients. And so what they did at that time is they would have hospital-based training programs. So these programs, usually the students would come in and they would have an apprenticeship type model, and they would learn from the nurses on the floor, but really they staffed the facility 24 hours a day. So it wasn't uncommon at all to have student nurses in on the night shift taking care of all the patients by themselves. So it was a very different time back then. And from that, they also, in about the 1930s, founded Boise Junior College, which spun off of that early nursing program.
So speaking of Boise Junior College, so in 1955, this is when the nursing school began?
Yeah, so Boise Junior College started in about 1932, but as nursing really evolved. So it was in that early time when it was really this apprenticeship model that we just started to become more and more aware that nurses needed more of a foundation in sciences and humanities, and needed to have a little bit more academic preparation to be able to do their job effectively. So what happened is in the early 50s, there was a lot of work that went on with the Idaho legislature, with the State Board of Education, and with healthcare facilities in general to say, what would nursing look like if it moved to an academic model? And there was a lot of support for that. And what happened is that the St. Luke's program actually merged with Boise Junior College and admitted their first cohort for a 3-year associate degree program in 1955. So we have that initial program, and then shortly after, about 11 months after, they started an LPN program, a licensed practical nurse program, to help fill the need for nurses in Idaho. So what this did is it changed the way nursing education was delivered from a very hands-on clinical skills focus and help to prepare nurses on a bigger scale as far as having a better understanding about biology and about how the human body works and about healing, and give them some more theoretical basis along with their clinicals and their skills and their practical knowledge. So that's how that shift happened. The first cohort graduated from Boise Junior College in 3 years, so in 1958. They realized shortly after that a 2-year program would work, and so they changed into a 2-year program, graduating that first group in 1959. So it really did change the shift in the focus for how we educate nurses. And then really what happened in the Valley is in the early 1960s, the clinicals changed from just St. Luke's to also include St. Alphonsus Hospital and the Veterans Affairs Hospital, the VA system. So that really, it filled a need in the community. So Boise State Nursing was all throughout the Treasure Valley and had a lot of support for what that looked like. We did not have a bachelor's degree the way we have it today for quite a while. So it was an associate's program and an LPN program. And then in 1975, Boise State launched a RN completion program. So that was for nurses who had their associate's degree program, and then they went back to school to get a bachelor's degree, but we didn't have a bachelor's degree. There was in 1976, they started a program where nurses could get their bachelor's degree, but it was you could be a nurse practitioner, you could be in acute care, or you could be in leadership. And so that was sort of a forerunner, but the traditional baccalaureate nursing degree that we have today didn't start until 1987. So it's been a really long and interesting trajectory for what nursing education looks like and how we prepare nurses. Our job looks very different. Yeah.
I want to interrupt, Kelly, because
Sure.
I'll only have like 2 minutes left with you. And I want to really get to what's going on today, because you have truly a state-of-the-art simulation lab. So quickly tell us about that and really the importance of where this program is today.
Yeah, so our program has just grown substantially. We have increased our cohort to 100 nurses per semester. And one of the big ways that we train is competency-based education. So we're really making sure that all of our students know how to do things and are able to critically think through new situations. And one of the important ways that we do that is our simulation center here at Boise State, where we train students in skills and also patient care. And the beauty of that is that I can offer the same exact experience to all 100 students. So they can all see and experience this situation, versus when they're in the hospital clinical, they get excellent experiences, but everybody's looks pretty different, and I can't standardize that. So what we've done is we've really married the simulation skills lab training with the clinical experiences they get out in the community and all of their didactic courses to really offer a program that we're very proud of. We're graduating very competent nurses in our baccalaureate degree and our BSN to DNP, which is a clinical doctorate degree where we train family nurse practitioners and acute care nurse practitioners. And so far, we've graduated about 10,000 graduates from our various programs.
Well, Kelly, I want to thank you so much for taking time to talk with us today. We should note that the College of Nursing is having a big event on October 25th to say thank you to all of their alumni. And that'll do it for this episode of Idaho Matters. Thanks so much for listening. And just a reminder, you can find all of our episodes wherever you get your podcasts.
Sources and methods, the crown jewels of the intelligence community. Shorthand for how do we know what's real? Who told us? If you have those answers, you're on the inside, and NPR wants to bring you there. From the Pentagon to the State Department to spy agencies, listen to understand what's really happening and what it means for you. Sources and Methods, the new national security podcast from NPR.